Hello, and welcome to Premier Study and Investing. Hey, what's up, everyone? Welcome back to Premier Study and Investing. Going to be looking again at Oncotelic because some news came out. Basically, here's the gist of where we're going with this. Oncotelic is a small company that's running a product for COVID. They're having someone in India called Windless Biotech Limited do their manufacturing for them, but they claim that they own, which seems to say that under this new patent that they are able to kind of like improve the quality or whatever. They have like a proprietary process, and so that's why this is a product that's going to be patented just by them. Here's what I'm saying, and I'm going to try to maybe ask more questions than I'm going to give you answers for. But if we go to the income statement, there's no sales all the way across the board, total revenue. Okay, now this is odd to me because if you go over to 1MG, which is like an Amazon type of site in India, like conglomerate called Tata, and the product has been PulmoHeal. It's in stage 4 trials, or phase 4 I should say. So, and you can see the Artemisia annea extract capsule, Windless PulmoHeal being sold. So what is the deal? Why do they not have any sales on their income statement when they have this product on the market being sold? Obviously, if it's on this website 1MG. Now, one thing I brought up in the past, you'll see right below 1MG to the right, not for medicinal use. And so I thought this is a little weird. It's actually, all the packaging says it's PulmoHeal, but not for medicinal use. Aren't they selling a drug? What is this? Are they selling a dietary, additive? That's what I've asked before. Uttar Pradesh, which is one of the states, but we'll look at some of that in a second. Where I'm going with this is, if it is true, in fact, that they've gotten rid of those two, I would call them blockbuster drugs. I believe they are effective based on what I've read. It is questionable. So if those are taken off of the table in India, there's 1.3 billion people. Would this drug be like kind of a good one to come and fill that space? Okay, so here we go. On October 18th, data lock and study data and analysis data models were generated. Phase 2, COVID study, double-blind randomized study of OT101, hospitalized COVID-19 patients. So OT101 is not the one that we just saw. It's not this. This is a different product. OT101 is like a synthetic drug that they have, or a synthetic version of a TGF-beta inhibitor. So that's kind of what this company's calling card is, TGF-beta inhibitors, as you'll read later. But like it says right here, safety endpoints met. OT101 is designated TGF-beta inhibitor. In the treatment, day 7 mortality for the entire study population was 4.5 for the treatment group versus 20% for placebo. Incidence of greater than 96% viral load knockdown at the end of treatment, 7 days, was 89% for OT101 versus 67% for placebo. So Pfizer and Molnupiravir, I think is how it's said. But the Merck one didn't do well. A lot of people are posting stuff about the Pfizer oral COVID drug. But then overall survival improvement 3x for critical COVID-19, 4 days for placebo versus 14 days for OT101. I wonder if they got mixed those up, because that is like, isn't that saying it's lower for placebo versus 14 days? Oh, I see what it's saying. I read it wrong. Overall survival improved. You want to survive longer, right? So 4 days for placebo versus 14 days for the treatment group. Yes, I guess that must mean that they died. Okay, so that's not as encouraging as I thought it was in the beginning. Okay, anyways, that's the truth of the matter. Let's say, for example, that the Indian government went with this study that put out ivermectin treatment for treatment of the disease, 2019. Come down here, results, conclusion. Compared with standard of care, placebo, IVM did not reduce all-cause mortality, LOS or viral clearance in RCTs in patients with mostly mild cases. IVM did not have an effect on adverse events or serious adverse events, and is not a viable option to treat patients with the C19. So let's say the Indian government picked this paper up wherever it came out of, and they ran with it, which I believe they did. So I'll try to give it to you in order, but AIIMS issues new guidelines for treatment of cases. It's April 22nd, and here it is, the same thing, AIIMS. And you can see this is dated May 17th, and if you Go down here, I'll zoom in a little bit, but they have mild, moderate, severe. And then if you look at this, you see you have the tabs ivermectin HCQ, okay? So they had it back there. That was when, sorry for the scrolling, May 17th of 2021. There was this other study that came out by the Desert Review. I don't know like how credible these people are, even where they're coming from. Imperial Valley News that matters to you. But they have all these like interesting, folks. They talk about the story in Uttar Pradesh, one of the states in India, where they basically like had like 0 cases, it's claimed, but then people said, no, that's a BS story. But anyway, here's one. Tamil Nadu rejects, it's another state in India, rejects India's ivermectin protocol. So it's the protocol on May 14th in favor of remdesivir that mirrored our U.S. FDA policy. To be clear, on April 22nd, the All India Institute of Medical Sciences, that's what we've been talking about, and the Indian Council of Medical Research, I'll look at them as well, added IVM as the protocol as an option for early treatment, even in mild cases. So we'll go ahead and we'll look at, there's another article. So then, like, what is this? September 30th, 2021, as ICMR revises the guidelines, India can exist or exit the thrall of IVM HCQ. So this basically says, September 23rd, India's apex medical research body, Indian Council of Medical Research, revised its clinical guidelines. So basically saying that they got rid of those two. So here, if you go to the updated September 23rd, same groups, and you go down here, and the same side on the mild side, they're gone. It's just inhalation booze azodine. I'm not sure what this is, honestly, but it's gone. So that's why I'm kind of thinking, that is interesting. What is India going to do? 1.3 billion people, and they just nixed those two things for mild cases. Now, they're going to basically talk about like the different states that basically refused to run IVM had like a lot of cases. So like in the Indian state of Kerala ranks in the top 5 most vaccinated of India's 29 states. However, if a vaccinated person spreads the virus while someone on ivermectin does not, that would explain Kerala's epic failure. The lesson, they say ivermectin can make up for the low use of vaccination. However, vaccination cannot make up for the low use of ivermectin. And so they give it, what is this, August 16th. Huge spike. What do they say? High vax, no ivermectin, like Kerala. And so, where is this? Is this? I mean, this is maybe just a screenshot. So hard to even say. Let's assume that that's true. If they're trying to make that case, or at least someone would make that argument. I think it's a believable argument. I mean, it's not like these two drugs have unknown safety profiles. People know they're safe. They've been giving them to people for forever. Not for forever, literally, but for a long time. So you might say if you, as a country, get rid of it completely, it wouldn't seem to improve your situation, right? I mean, if the drugs work, then your situation is going to get worse. If the drugs don't work, then your situation should stay the same if you ban them. So maybe that's a case for people going back and looking at PulmoHeal and saying, this is, I mean, if we can't get this, if you're talking about like a Canada, a New Zealand, an Australia, where these, people have basically coerced their doctors into not prescribing certain drugs, threatening their licenses and all that stuff, then yeah, I mean, maybe this would be maybe the next drug of choice. I don't know. I'm just trying to make a case for it. How many dollars equates to 945 rupees?
I found this on the web.
Yeah, tell me. So this is $12.43 US at the time of this video. So, and this is with the discount coming off of 1,200 rupees. So, but only 11 people bought this recently. I don't know how much money they're making off this. I guess if you go off of, if this money is going to come back into Oncotelic's profit and loss statement, then I guess they're making less than $1 million off this so far, which is not very encouraging. So for whatever reason, the stock has been up and down. I mean, 15 cents was okay. If we go to the summary, it was up at 17 cents. And year-to-date chart is, you know, I mean, this is basically going 12 months at this point. So coming off of some of these bottoms, it's nice to be at 15 cents. I think we've been up to like 17 cents even. Yeah, but like, so to be back down at 15 cents, okay, like, okay. But I don't know if there's really a story there. I don't know if you can really say that. When did they get rid of, it was September 23rd, right? India made the decision. Wow, here we are, September 23rd right there. You wouldn't say that there was like an immediate run up in the stock price and a lot of people were excited about this. So I don't know. I kind of feel like I should get out of it. That's what I think. What do you guys think? Let me know. Appreciate it. Talk to you on the next one. Bye.